The treatments vary greatly depending on the woman's symptoms. Many times we do treatments with medications for nerve or neuropathic pain, such as a group of drugs called tricyclic antidepressants, and some anti-seizure medicines are also extremely effective for nerve pain. As I mentioned in talking about the bladder anesthetic test, we can also use that as a treatment where we put anesthetic and heparin in the bladder, the anesthetic to stop the nerve pain, the heparin to try to repair that defective gag layer that we talked about earlier, that mucus protective layer. So those are some of the treatments. Occasionally we have to use certain types of pain medications. And one of the things that women can often do for themselves is to modify their diet. There are several things that specifically seem to be irritants to the bladder when you have interstitial cystitis. Caffeine is notoriously one of the worst, so avoiding caffeine can often greatly decrease symptoms. Alcohol is another that seems to be a real generator of pain in women with interstitial cystitis. Spicy hot foods, particularly with peppers, also seems to be a significant irritant for many people. Avoiding carbonated beverages is also worthwhile. And then finally, many people find that citrus-type fruits, oranges, including tomatoes, are often significant irritants. So those are all things that a person can do for themselves, so it often will improve their symptoms. In fact, it's been my experience that about a third of women diagnosed with interstitial cystitis will actually get sufficient improvement in their symptoms just with dietary and lifestyle modifications that they really don't need particular medical treatment for their condition. So I hope this has given you some information about interstitial cystitis or bladder pain syndrome that you might find useful and helpful. And certainly I would encourage you, if you think that you may have this disorder, make sure you seek expert care because it is a condition that we can treat very effectively. Thank you.